Okay, looks like the recording has started.
Hello, everyone. Thank you for joining. We will just wait a few minutes till we give people a little bit more time to get here, and then we will get started a little bit after the hour, depending on where you are. Hello, everyone. Thank you for joining us. We will just give a few more folks some time to get here, so hang there with us and we will start shortly. Okay, it looks like it's 2 past the hour, so let's get started. So I would like to welcome everyone. Thank you for joining us today from wherever you may be today. My name is Chana. I'm the Communication Director here at the National Environmental Health Association. And before we get started, I just have a few housekeeping items. First, I wanted to remind everyone that our call for abstracts is now open for our annual education conference. So I'll put a link in the chat for anyone who might be interested in sharing their expertise by submitting an abstract this year. And then today we're going to be hearing from our Government Affairs Director, Doug Farquhar, and our guest speaker, Dr. Sharonda Buchanan. We will have time for questions after the presentation, and you can go ahead and type your questions in the Q&A box throughout the presentation, and we will get back to them. The session is also being recorded and will be available on our website in about the next 48 hours or so, probably sooner. With that said, I will pass this over to Doug. Doug, take it away.
Thank you very much, John. I'm really happy to be doing this webinar today. NEHA has been involved with environmental justice for some time. We have done policy statements, on the issue, and we have done position statements as well, writing letters of support and to identify concerns regarding environmental justice. The Biden administration has also taken action regarding environmental justice. Early on in the administration passed Executive Order 14,008, entitled Tackling the Climate Crisis at Home and Abroad. This order establishes Justice 40, mandating 40% of climate change programs go to disadvantaged communities. It also provides for the Council for Environmental Quality to identify these disadvantaged communities. Recently, Congress passed and the administration, the president signed the Inflation Reduction Act of 2022. This act will provide for a greenhouse gas reduction fund, a clean energy and sustainability accelerator funded at $27 billion, with identifying at least 6% of those funds going to disadvantaged communities. There's also $315 million for air monitoring, so communities know exactly what's in the air they breathe, with specific funds for schools and those living near polluting industries. $3 billion is also available for the environmental and climate justice block grants for community-led projects in areas experiencing disproportionate impacts of pollution and climate change. The neighborhood access and equity grants funded at $3 billion will support neighborhood equity, safety, and affordable transportation access with competitive grants to reconnect communities divided by existing infrastructure barriers, mitigate negative impacts of transportation facilities, and support equitable transportation planning and community engagement activities. There's also $50 million to address air pollution at schools by monitoring and reducing air pollution at public schools at low income and disadvantaged communities. $87 million is available for low emissions electricity program to support low income and disadvantaged communities, and to offer technical assistance to industry, as well as state and local governments as they work to reduce greenhouse gas emissions. NEHA was supportive of the Inflation Reduction Act and wrote letters of support for this act. But one of the most important things that the administration has done was bring on Sharonda Buchanan. Dr. Buchanan came from the CDC's National Center for Environmental Health, where she oversaw their environmental justice efforts, health equity innovation, and various other large-scale priority environmental health initiatives. She has been named Interim Director of the Department of Health and Human Services Office of Environmental Justice, and will be speaking with us today on the administration's efforts to deal with environmental justice. And with that, I'd like to turn it over to Dr. Buchanan.
Really appreciate it. Good afternoon, everyone. Thank you so much, Doug, for that introduction. And I want to just say at the outset, thank you so much for inviting me to actually just talk a little bit about what we're doing at HHS, and particularly my office, the new Office of Environmental Justice. And hopefully you guys can see my screen. And
We can.
Okay. Trying to advance my slides, guys.
Try the down arrow on your.
I promise you I didn't touch anything. He's stuck. Maybe I should sort of pitch it back to Neha and let you guys advance the slides. Would that be okay?
For sure.
Okay, I'll stop sharing and I'll turn it back over to you guys. It
Okay.
seems like, how's that?
There it went.
Just seems to be stuck. Okay, let me just start off by saying, my objective today is really threefold. I want to provide an overview of the Office of Environmental Justice. Also want to bring attention to the intersection of health equity and environmental justice. And then lastly, I want to highlight the utility of the Environmental Justice Index as it addresses determinants of health in pursuit of environmental justice and health equity. I always like to start off with terminology just to bring us all on the same page. And again, there are many definitions that I'm actually going to focus in on related to health equity, environmental justice, and social determinants of health. but these are the ones that I am focused on and I use in all of my discussions with various entities, et cetera. Health equity, striving for the highest possible standard of health for all people and giving special attention to the needs of those at greatest risk of poor health based on social conditions. Environmental justice, and this is another where there are many definitions of environmental justice, no uniform or universal definition, but this is the one that I use. Advancing health equity and eliminating environmental health disparities through the fair treatment and meaningful involvement of all people in environmental health policies, research, and programs, and ensuring equal access to a healthy environment. And then last but not least, social determinants of health, conditions in the places where we live, learn, work, play, pray, that affect a wide range of health and quality of life, risk, and outcomes. This is one thing that you will always hear me say. I sound like a broken record, probably at HHS and in other venues, but environmental justice is linked to health equity. These two things are inextricably linked. If you find an environmental injustice, I'm guaranteeing you, you're likely going to find some kind of health-related disparities. As we think about, environmental hazards and issues in our environment, again, the bottom line all draws us back to the fact that, is my health at stake? Am I going to remain healthy? Is my health going to be, again, at stake for the most part? So environmental justice at the outset is linked inextricably to health equity. So Doug mentioned Executive Order 14008, but I just want to do a little bit of background. Back in 1994, during the Clinton administration, Executive 12898, I believe, was sort of the inaugural executive order where it stated that federal actions to address environmental justice in minority populations and low-income populations, directing federal agencies to making achieving environmental justice part of its mission for identifying and addressing, as appropriate, disproportionately high and adverse human health or environmental effects of its programs, policies, and activities on minority, low-income, and indigenous populations. So take it back several years, particularly beginning to focus on environmental justice and the need for all of our federal agencies to begin to focus on this. Again, reiterating Executive Order 14008. The Executive Order 14008 further directed, again, when the Biden administration came in, agencies to make achieving environmental justice part of its mission by developing programs, policies, and activities to address the disproportionately high and adverse human health, environmental, and climate-related and other cumulative impacts on disadvantaged communities. So the theme resonates, and what we have begun to see that this whole issue of climate-related extreme weather events is really impacting, again, low-income minority communities, communities of color, if you will. So I wanted to start off by saying the mission of the Department of Health and Human Services of HHS is that we really want to enhance the health and well-being of Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. And at the outset, they knew that there is a rationale for environmental justice. HHS recognizes that people of color, disadvantaged, vulnerable, low-income, marginalized, and indigenous people are disproportionately burdened by environmental hazards. These populations and communities are exposed to environmental threats that drive health disparities, they're underserved, and they're surrounded by social inequities. The combination of environmental risk and social inequities create a cumulative, disproportionate impact that hinders optimal health. And again, it boils down to health and environmental justice for these populations. Again, if you address the environmental health issues, if you address those injustices, you address optimal health. And that's where we want to go. Again, this whole concept and rationale for environmental justice. As Doug mentioned, that HHS saw this, and in keeping with the executive orders, not only from 12898 in 1994, but again, now fast forward that all the way to 2020, when we're focused on these issues, environmental justice issues related to climate issues, HHS, of course, is on the cutting edge, and they announced the new Office of Environmental Justice. I just happen to be fortunate enough to be named as the interim director. And I want to just talk a little bit about and share with you some of my priorities for this office. The office was officially established within the HHS Office of Climate Change and Health Equity on May 31st, 2022. But almost a year ago, even before my office was created, this new Office of Climate Change and Health Equity had its birthday, and it was established. And so it just seemed reasonable and likely that this Office of Environmental Justice would be nested in the Office of Climate Change and Health Equity. Because as I told you at the outset, environmental justice and all of what that deals with is inextricably linked to health equity. And so bringing those two things together, there are a lot of environmental justice outside of climate, and we know that climate change is an effect multiplier, but we want to focus on some of those traditional issues that have long plagued communities: lead poisoning, chemical exposures, those things that are exacerbated by climate change and have been existing for a long time. And that's the focus of this office. The Office of Environmental Justice will serve as a departmental-wide hub, meaning looking across the department for leading initiatives that integrate environmental justice into all of HHS's mission to improve the health and environmental justice communities and for vulnerable populations across the nation. Again, not only bringing the health component into this, but also the human services part of this, because all of those taken together will make a holistic approach for addressing environmental justice issues. The mission of my office is to protect the health of disadvantaged communities and vulnerable populations on the front lines of pollutions and other environmental hazards that affect health. My ultimate goal is to be a resource for underserved and overlooked communities. That's the bottom line. We want to really be that conduit. We want to be that resource. We want to be here at HHS, that conduit for addressing these issues and helping communities to do that as well. I want to talk a little bit about some of the priorities that my office is focused on. Just out the gate, again, you'll hear me mention this all the time. My ultimate goal is to be a resource for underserved and overlooked communities facing environmental injustices. I want to mobilize efforts across the department, and I've already started to do that. And I'll tell you a little bit more about that in some of the ensuing slides. As I mobilize efforts across the department, helping people to realize and helping their divisions, not only the operating divisions, but the staff divisions, realize that they have something to bring to the table. Again, if we're going to address this in a coordinated, comprehensive fashion, a holistic fashion, we need to be looking across the department to help to address these issues. Again, I'm in the throes of developing and implementing an environmental justice strategic plan. I'll talk a little bit about that in a second. Doug mentioned Justice 40. I'll talk a little bit about what we're doing, HHS is doing under this rubric in terms of strengthening HHS Justice 40 efforts here at the department. And then I want to talk a little bit about, lastly, some of what we want to do to help and empower communities to address the disparities they face at a local level by providing tools and resources. And we'll talk a little bit about the Environmental Justice Index that Doug mentioned at the outset. So I just wanted to present this slide. When I talk about across the department, here are the major operating divisions. There's HRSA, there's CDC, there's CMS, there's ATSR, there's NIH. Again, not only the operating divisions, the staff divisions as well, our Office of Policies, all of the office coming together to address environmental justice, again, in a holistic approach. I always like to sort of do this so folks will realize, yeah, it's not just, kind of HHS in a vacuum. We couldn't do what we do with all of our operating divisions, and they're all at the table and wanting to infuse and interject all of what we do around environmental justice into their work, into the individual missions of these divisions. I talked about strategic planning. So, this is very, very key. 12898 as well as 14008 calls for all of our agencies to develop a strategic plan. This is something that we wanted to do, even if, it wasn't in the executive order. When I came on board as interim director, there was an environmental justice strategic plan that's nearly a decade old. I think the last strategic plan that was done in the area of environmental justice at HHS was 2012. Again, you can see it's now time for a new plan. And what can we do in terms of providing program-specific actions across the department that holistically address community concerns? I want to talk a little bit about a request for information that went out, I would say a couple of months ago. It may be 2 to 3 months ago, time flies when you're having fun, where we wanted to gain input from the public and from various entities across the nation on what we should be focused on or what we'd like to be focused on for this strategic plan. Again, once we develop the strategic plan, we're going to be about the business of implementing that strategic plan. Again, what does HHS bring to the table? If you think about services and all of the human services that we have to bear, partnerships and community engagement that we want to do, not just working in a vacuum, but again, working across the regions, working with localities, working with communities, again, engaging communities and partnering with communities to help to build our strategic plan so we know what the actions are. So we can, again, work with communities to really sort of hone in on those strategic actions. Policy development and dissemination, meaning are there gaps in policies that really need to be developed to address some of these EJ concerns and these EJ issues that are out in our communities at large. Research, data collection, analysis, and utilization. Again, not just collecting data for the sake of collecting data, not just doing research for the sake of doing research, but again, how can we address holistically in these areas? What are the gaps, the data gaps? What do we need to do to really hone in on some of these issues, some of these things that are affecting our communities at a local level? One of the other major parts of the strategic plan would be education and training, both internally, meaning internally to the department as well as externally. What are some of those things that we need to create and develop or either promote that already exist? And then performance measures is last but not least, to hold ourselves accountable for what we're doing. We're going to put something in the strategic plan. If we're going to announce actions and do that, we want to hold ourselves accountable, and we want communities to hold us accountable for the actions that we do and make sure that they are implemented. All right, that brings us to the whole concept of Justice 40. And again, this may be new to some and may not be new to others. I'll just reiterate what Doug mentioned at the outset. Justice 40. It's a whole of government approach across the federal family to ensure that all of us in this federal level who work with states and local communities to make good on the promise of the president to deliver at least, I always like to say, at least 40% of the overall benefits from federal investments in climate and clean energy to disadvantaged communities. I always say at least because we want to do more. We don't just want to do the bottom line, but if we can get at least 40%, that will be a big lift and very, very important to communities that have been impacted by environmental justice issues, particularly in the area of climate and clean energy for a long time. There were interim guidelines that were set forth, and these interim guidance by the White House includes a set of actions required of all agencies that manage covered Justice 40 programs. And I'll talk a little bit about that in a second. This interim guidance not only gives sort of direction for us as agencies that manage these Justice 40 programs, but there's also direction to the covered programs under this interim guidance, this Justice 40 initiative. So you heard me say covered programs. What is a covered program, and who and what does this entail? Covered programs provide overall benefits from federal investments in the following areas to disadvantaged communities: climate change, clean energy and energy efficiency, clean transportation, affordable and sustainable housing, remediation and reduction of legacy pollution, critical clean water and wastewater infrastructure. And then I have here, it's not only about those issues, but also training and workforce development related to these issues, related to climate, natural disasters, environment, clean energy, clean transportation, wastewater, water infrastructure, legacy pollution, including energy communities. So not only is HHS in this space, but across the government, we're all coordinating, collaborating, and focused in on how we can together, again, the whole concept of providing feedback and investments into these communities to address these issues in disadvantaged communities, communities that have been affected for a very, very long time. I just wanted to also provide so that folks can see a number of agencies have covered programs. HHS right now is prioritizing 13 covered Justice 40 programs. And I provided these here just so you can get a sense of who they are, what they bring to the table. I'm starting at the low income home energy assistance program. And for those of you who want sort of detail down to the nail of what these programs provide, it's also a link to all of these programs. Now, again, what can we provide in the area of low energy assistance? Because we know that that's been an issue in our environmental justice communities. Low income household water assistance program. These are all programs under our Administration for Children and Family. There's a community service block grant program, a community economic development program, and then also a rural community development program, all under the rubric of the Administration for Children and Families. Also, for the administration, secretaries, administration programs, there's what's called Federal Real Property Assistance Program, and they give back, again, properties and helping to build properties in environmental justice communities that can help to support, for example, homelessness, et cetera. And then I'm also going down the list to a number of CDC ATSDR related programs. There's the Climate Ready States and Cities initiatives. There's the Pediatric Environmental Health Specialty Units. There's the Office of Community Health and Hazard Assessment. And then many of you may be aware of the Partnership to Promote Local Efforts to Reduce Environmental Exposure, or the Apple Tree Cooperative Agreement that's spearheaded by ATSDR. There's the Flint Lead Exposure Registry. Many of us are familiar with the Flint water crisis that happened a few years ago, and CDC established a lead registry, a lead exposure registry of those 9,000 some odd residents that were affected by the water crisis in Flint. There's IHS's, the Indian Health Services Sanitation Facilities and Construction Program. This is a program that was, of course, named in the infrastructure bill that's getting millions and billions of dollars to actually help to build infrastructure, to upgrade infrastructure, particularly in indigenous populations and tribal communities for the most part. And then I also want to highlight the National Institute for Environmental Health Sciences Environmental Career Worker Training Program. And this is a program that's been in existence for a while, where they go into communities, they work with grantees in communities to really make way for jobs and workforce development within communities that would need cleanup, that would need remediation. And so these are the programs that HHS is prioritizing and really going to be focused on. And HHS, the Office of Environmental Justice, will be providing technical assistance to these programs to really ensure that at least 40%, but in some cases it's going to be 50%, some cases 60%, some cases 100%, because a number of these programs are focused on doing just that, providing those benefits to these communities that have been affected for a long time. So this brings me down to, again, the whole concept of building tools and providing resources that not only public health officials can use, not only researchers can use, but also communities themselves. I always like to provide this slide because it just sort of showcases how all of this is interconnected. The social, the cultural, neighborhood, and built environment. When we talk about social determinants of health, which includes environmental determinants of health, all of this is interrelated and interconnected. And I always like to provide this overall kind of slide just to give a sense of how it all does connect and how it all is aligned and how you can't disconnect any of this. And when you talk about racial residential segregation, then you're thinking about education and poverty and spatial mismatch. There's the whole concept of urban sprawl, where you're talking about noise and mental health and overcrowding, indoor and outdoor air pollutions. And these are issues that are affecting these underserved communities, disadvantaged populations, or indigenous populations. Inaccessible resources. Again, these social aspects, these social determinants of health, where their lack of job and transportation, food, fresh food. And this is an EJ issue as well. Without access to fresh food and without access to healthcare, again, that is a determinant of how healthy a community might be or individuals might be. The whole concept of dilapidated housing, and that's a big issue. Again, the longstanding issue around lead poisoning and asthma, injury, poor nutrition, when you're talking about dilapidating housing. And then last but not least, community design and how we build our communities really affects our health. Again, in terms of obesity and thinking about that, what's the walkability of a particular community? How can we get the exercise that we need? The lack of green space and parks and recreation and public spaces in terms of thinking about how we build and design our communities. Again, all of these are inextricably related to health, and sort of is the groundswell for helping to address these issues in pursuit of environmental justice. Which brings us to the fact that one of the other priorities of my office is to help to identify tools and a data strategy for addressing these issues that affect communities. And as Doug mentioned at the outset, my office here at HHS's Office of Environmental Justice is collaborating with the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry. Just last week or week before last, it was August 10th, we unveiled or released a national tool that will help to address and actually sort of hone in on the communities that are facing a number of cumulative impacts related to environmental justice. So by way of introduction, this Environmental Justice Index is a comprehensive place-based index that identifies and characterizes the cumulative impacts of environmental, social, and chronic health conditions facing disadvantaged communities across the US. I mentioned just prior at the outset of how all of this is interrelated. And so the cumulative aspect of this is really, really key. And you'll see here, I kind of have this asterisk here at the bottom that says cumulative impacts are a measure of the total harm of human health on environmental burdens, chronic health conditions, and social stressors. So these things taken together really impact our communities. It's not just the environmental stressors that are affecting our communities. It's not just those environmental burdens, but the social aspects of all of what underserved communities are dealing with as well, coupled with those chronic health conditions that they're facing. This index builds upon the social vulnerability index, and I'm not sure how many are familiar with that, but this is something that was created a number of years ago by our geospatial research program at CDC that sort of focused in on the social aspect of this to really identify communities that were probably most at risk when you're looking at the social vulnerability aspect of this. So this Environmental Justice Index builds upon the SVI, the Social Vulnerability Index. It delivers a single environmental justice score for each community to identify and map areas most at risk for the health impacts of environmental burdens. It also scores communities on each of the 3 modules, meaning you can go into each of these 3 modules, the environmental burden module, the social vulnerability module, the health vulnerability module, to really get a sense of what's happening individually in terms of the environmental burden, the social vulnerability, or the health vulnerability, looking at these individually, but also bringing them together to bring to bear a cumulative score that will give you a sense of what's going on in these communities in a cumulative way. It's not just, one as individual or one part of this, just environmental burden, but collectively, these are things that are affecting environmental justice communities. Individuals and community-based organizations, public health officials, local, state, federal level, scientists, researchers, communities, we all can collectively utilize this tool or take a look at this tool, use this tool to identify and prioritize areas that may require special attention or additional action to improve health. It also can be utilized to educate and inform communities and the public about what's going on in their own communities. I mean, I want to know what's happening in the area of Lithonia, Georgia, or Dunwoody, Georgia, or whatever the zip code may be, to really figure out what's going on in my communities. I already know, probably because I'm affected and I've been in this community for a long time. But again, let's see where it lands on the scoreboard, if you will. Also, the EJ index can be used to analyze the unique local factors that are driving the cumulative impacts on health to inform policy and decision making. Again, this is very, very key. If you find one issue in your community that's, as you hone in on these in terms of health vulnerability, it will give you some insight as to what's going on in those particular communities or in your particular communities. And then we want to use the Environmental Justice Index to establish meaningful goals and measure progress toward environmental justice and health equity. I provided here the website address, CDC's website address. I want to drive you to that. I want to drive you to that to start playing around with the tool, play around with the index, get a feel for it, see what it can provide to you. We're also going to have a series of I'm going to say webinars and engagement over time where we do some demos. We want to hear feedback on how useful the tool is, what's missing from the tool. Again, this is our first, sort of layout of what this tool is. We want to get feedback. We want to make it as useful as possible. It's not the end all and be all, but we want to make it better. It has lots of utility at the outset, particularly as we think about what's going on in communities, and again, that cumulative impact surrounding those communities. Engaging communities, and this is probably my last slide, or at least next to the last slide. This is just very, very key and very near and dear to my heart. If there was nothing else said, I said at the outset, I want to be a resource for underserved and overlooked communities facing environmental justice. So in keeping with the principles of environmental justice, those partnerships and engaging communities at all levels, at every step of the way, is really, really important. So not that, this office will be, jutting out and doing this without that community voice. I want to hear what communities are faced with. I want to hear what those issues are. OEJ, again, wants to be the conduit, the resource. particularly as it relates to health and how we can bring that comprehensive, holistic approach to environmental justice as we're talking about here. Again, hearing and understanding those community perspective and incorporating that feedback into all of what we do to meet the goal of this office and then to meet the goals that are of the individual communities to address the issues that they are being affected with on a day-to-day basis and have been for a very, very long time. So with that, that's the basis of who we are here at HHS, the Office of Environmental Justice. I am so just warm-hearted and excited that I've been named as interim director. Again, I want to hear feedback. I want folks to be able to knock on the virtual door, if you will, and even in some cases, the actual door, to really hear about what these issues are. How can we be a help? How can we be a resources as we think about equality, as we think about equity, as we think about justice and pursuing justice for communities? Again, that's what this Office of Environmental Justice wants to do. So I've just presented just sort of the big picture of some of the priorities. As we're moving forward, again, we are building, we're shaping. We are right now a very, very small unit, but we are blossoming and we want to be the best that we can be. Again, we want to seize the moment and take advantage of the fact that not only has HHS, developed this Office of Environmental Justice, but a number of my sister federal agencies have done the same thing. We're not just working in this space in a vacuum, we're coordinating across the federal family to address some of these issues. And again, that's how I think we can be most effective. Again, there is, as we say, the age-old adage, there's strength in numbers. And so if we are collectively addressing these and we're talking and meeting on a regular basis with our partners across the federal government on how we can do this collectively, we really want to be able to make a difference, particularly in these overburdened and overlooked communities that are affected by these environmental hazards and have been for a very, very long time. So with that, I am going to turn it back over to you, Doug, and others at NEHA, and hopefully
Thank you.
a few questions. Okay.
Thank you, Dr. Buchanan. That was wonderful. We do have a few questions for you, so I'm just going to read the first one, and if you wouldn't mind taking a stab at it.
Okay.
This is from Diana. How do HHS programs incorporate access to parks and green space to address health? And then in brackets, promote physical activity, reduce obesity and chronic disease.
Right. So, and I don't know how many of you are aware of, I can particularly speak to the work that CDC's Chronic Disease Center is focused on. And they have particularly been focused on, again, the whole concept of sort of community design and access to health and walkability and health spaces, if you will, green spaces, if you will. And there's been an effort afoot to really begin to work closely with the Department of Transportation, because that's really, really key. Because again, I talked about at the outset, the way you build and design your community is very, very key. And one of the things that we want to think about is how do you move people from one place to the other? So again, how does that transportation piece fit into that? Yes, we want to, have our cars, but we want to reduce emissions. We want to, have, I'm going to say, access to healthcare in these communities. So again, how do we build and design our communities so that we can get the best of what we do? Again, making sure that there are parks and green spaces as well. And that's one program I want to kind of direct you to and link you to. Again, I am working across the department to bring that holistic approach. Again, I tell all the divisions, the operating divisions, you have something to bring to the table. Again, CDC with this climate and health program, ACF, with this making sure that schools and childcare facilities are focused on. I don't know how many of you are aware of this lead, paint, and pipe plan, making sure they have clean access to water. So collectively sort of focus on those issues around the department, that they all have something to bring to the table. We talked about stressors. I mean, there's this whole issue around HRSA, and we can bring some services to environmental justice communities and make sure that they have that access to healthcare. There are pediatric environmental health specialty units on the ATSDR side, collaborating with EPA on that. And so collectively, again, around the department, these issues, again, bringing that holistic approach to make sure that it is in fact a holistic approach. And so that's what we're doing. Wanted to direct people to that.
Thank you. The next question is crime activity counted in the cumulative impacts? For example, it's not safe to walk our neighborhood or go to the park because there are shootings each day.
Yep. And I also want to direct people to the EJI. And what we did is there are approximately going to 36, I think, indicators, if you will. One of the indicators is walkability. I would just sort of direct you to what's called the technical documentation that's going to give you some insight on all of what's related to walkability in a community. I can't remember at the outset, is violence an issue, an indicator, if you will, but I can say, working with the CDC, the Division of Violence and Injury Control, again, how can we bring these issues to the table? You may not have environment in your name as an operating division, but there's still something you can bring to the table, thinking about, again, sort of walkability and designing communities and the issues around violence and all of that stuff. So again, go to the website, the EJI. It's going to give you a detailed list of all the indicators in each of the modules, and it will kind of give you the background. What we wanted to work with were national data sources, and so some of that is limited by the sources and the amount of data that we actually have on hand. But again, that's what I said. We're working to make this. This is a work in progress. It's not the end all and be all, but we want to make it as best as we can as we move forward.
Thank you. Gabrielle asked, what was the term or phrase for old waste dumps that continue to be harmful?
Old waste dumps that continue to be harmful. You say, was there a term for it?
Yeah, what was the term or phrase for old waste dumps that continue to be harmful?
I'm not quite following that, but
okay.
Maybe they're thinking that, this to me, when we talk about legacy pollution, that's something that falls under that rubric.
Oh, maybe legacy pollution is the term.
Maybe legacy pollution is the term, dump sites. So I don't know how many people know my story. I always like to tell this because many people know Bart Bullitt, who's the father or grandfather of environmental justice. Dr. Bullitt and I come from the same area in Houston, Texas. Actually, Bob is from Houston, Texas. He is an emeritus professor at Texas Southern University, which is my alma mater. And one of the things that really got me enthralled and intrigued in the whole concept of environmental health and environmental justice was that, I was, raised in the area of Houston, Texas, which is right near, if anybody knows Houston, Texas, there's a big ship channel. It's a port city. And, we grew up in sort of our formative years in a community right near the ship channel. And I can recall always looking up at nighttime in the bright blue sky and seeing, this sort of gulf of it looked like fire, it looked like a dragon, when you're 5 or 6 years old, it just seems so massive. But my sister always suffered with asthma, and my mother would always say, "Man, I'm sure it's related to all of this pollution and the fact that this is a port city and we're living there." So we always said, we thought, it was something about the environment that's particularly focused on health. And I recall sitting around the table one day because my father was head of the civic club, and we were sitting down. We were waiting for him to come to the dinner table, and all my siblings, there was 4 of us sitting around the table and perched and ready. And all of a sudden we were watching TV, waiting for my father to come home, and we saw him on the TV sort of being carried away in this sort of police wagon or whatever. We're like, oh my God, what's happening to Dad? But, he was always a proponent of, protesting and making sure that environmental justice was addressed in our communities. And there's a whole concept. And so, again, this work that I'm doing in environmental justice is not just work for me. The work that we're doing in environmental health as a whole, this is my life's work. This is my life's passion. I really want to make this issue and deal with this issue from this holistic perspective. And so I always can relate. And that's why I know it's important. It's important work, because having come from that community, I understand what's affected here and what's at stake here. And again, it's about the health of individuals and the injustices in our communities that present themselves for so long.
Do you have time for a few more questions?
I will.
Okay. Brian, this is a perfect follow-up. Brian asked, from your viewpoint, what will progress look like? How do we measure positive impacts? What does success look like, especially when this issue of equity often only receives lip service?
Right. In my estimation, I would like to see progress, of course, across the country. But I say if we can help one community, again, I want to help millions of community, but if progress is going to be, particularly for my office, a community says, hey, Sharonda, we have this issue. It's health related. It's affecting, us. What resources can you bring to bear? And we bring resources to actually affect what's going on in that community. To me, that's progress. And we do that possibly one community at a time. Again, it's going to take some effort to do that, but that's what progress is going to look like. And again, progress, and I'm already seeing it from my vantage. I'm really getting the department as a whole, as I mentioned, to really see what resources they can bring to the table. A lot of times, and I mentioned this at the outset, people says, oh, I really don't do anything in the area of environmental justice. No, yes, you do. Yes, you do. Even if it's in, SAMHSA, where we're talking about drug overdoses and the fact that there's stressors. Is there something that we can do and connect to and relate to sort of addresses these issues again in what we're calling disadvantaged or environmental justice communities? So they're really coming on board. They're reaching out to me and saying, Sharonda, we want to work with your office. We want to partner with your office. These operating divisions were saying, we have a program that we believe that can address these issues. We have a program that we want to provide as an arsenal that really will help to address an environmental justice or an environmental injustice in that community or health inequity in that community. So again, to me, we're already being successful and we want to make sure that that's done. We want to increase that effort. We want to do this not only, again, in the one community, the second community, the third community, and so on and so forth. So that's what success would look like, again, or progress. Again, you can't go into this with the same mindset that actually caused the problem. You got to have a different mindset. And at the end of the day, again, you got to see, again, some progress that's being made. And that also, too, is going to be determined by the communities themselves. If they have seen progress in their own communities, that's what says what progress is. And again, that's going to be kind of the yardstick.
Thank you. This person says, thank you for your important presentation. Would you elaborate on your work with EPA and their role in environmental justice, given their important role in regulatory oversight of the chemical industry?
Right. We work with EPA on a number of different fronts. Again, EPA, as many well know, has had an Office of Environmental Justice. I think they just celebrated the 30th year. And although HHS at the time didn't have an Office of Environmental Justice, I know that there are lots of streams along the continuum where we work together. Again, as you think about, as you're saying, water issues and again, the environmental part of that, the infrastructure, I always say the primary prevention part of that, actually dealing with the environment itself, but also connecting to to the health piece of this because it all weighs boiled down to health. I've been in several conversations, they're local conversations where we're all coming to the table, not only HHS, but EPA, and we're doing that regionally. Who are the regional health administrators? Who are the regional environmental regulators? You know, coming to the table where we all know that we have a part to play to address those issues that are going on in communities. There are a number of things that are going on right now. I don't know how many of you have been following the Lowndes County issue, the wastewater issue. I think it was on 60 Minutes for a long time. We're currently working with, a number of entities, and one of which is EPA, is how can we address some of these longstanding issues together? Again, them looking at the infrastructure, but us coordinating the health piece of this. What are the health related issues? What are the health outcomes? And so a number of these kinds of issues that are affecting our communities, we want to work together on, again, because they go hand in hand. Environmental injustices, and health inequities and health disparities.
Yes. I mean, there's only one way to do it, and it's this holistic way that you're talking
Right,
about.
exactly.
Yeah. We have a couple more questions if you're up for it. David's asked, will there be more funding for new states and cities to participate in the BRACE framework?
Fingers crossed. We're hoping that there will be. It's looking good. Yeah.
Okay, great. Have you reached out to Blue Zone founder Dan Buettner on how to engage communities in investing in changes to the built environment as a means of improving community health?
I
The
have
Blue
not.
Zone, you have
Yeah,
not.
but definitely make sure, Chana, if you can, definitely capture that for me and
I will.
be proactive, and we'll reach out. Would love to do
Wonderful. Wonderful. Thank you. And our last question is our statement. Diana says, thank you, exclamation point. We would love to explore opportunities for HHS environmental justice and the National Park Service. They have an Office of Public Health and a Healthy Parks, Healthy People program.
Great.
So I'll help make that connection as well.
Definitely. Please do. Love to.
Great. Well, that is our last question. I have one for you. If folks want to give feedback on the EJ index, how can they do that?
Right. If you would actually go to the site, there's going to be a space that says EJ coordinator. There's an EJ coordinator box, and all of that's going. Any issues that you have, any concerns, any feedback that you want to provide, go ahead and do that right now. And again, as I mentioned, from now until probably a year from now, we're going to be doing some webinars. We're going to be doing some demos. We're going to be making a space for actual, for example, like this, where you can provide direct feedback. But, right now, while you're going and sort of playing around with it on your own, or at any time, maybe if you do it today, if you do it tomorrow, whenever, that's going to be the space and the box that you can drop things in. And we get those every day, and we're addressing those issues. And even if it means, dialing you up directly or what have you, just sort of put that in that box.
Wonderful. And we will make sure to share all of that information with everyone on this call and all of our members.
Great.
So.
Thank you.
Do you have any final words you'd like to share?
Would that be me, or would that be?
Oh.
Okay. Yeah. Go ahead, Doug.
Just final to say a great thank you to Sharonda. You've been a friend of NEHA for years, and we're just so excited you're in this role, and now we can work together.
I agree. Well, thank you. I appreciate NEHA so much, and I appreciate all of what you guys bring to the table. Just kudos to you guys and all of the work that you continue to do. And to all of our environmental health officers, environmental health specialists, and all of what's brought to the table in terms of environmental health. This is really, really key. So kudos to you guys too. It's a pleasure.
Thank you so much. Thank you so much. And I will follow up with you with that other information.
Okay.
And everyone on the phone, we will follow up with any follow-ups as well.
Follow-ups.
Wonderful.
Thank you guys. Appreciate it.
Okay,
Have a
thank
good day.
you. Have a great afternoon.
Okay.
Bye-bye, everyone.